Ironically, now that I'm in my 40s, I felt like I was in the best shape of my life. That is until back and neck discomfort started to dominate my life at the beginning of this season, season 8 of The Doctors. I've been active as long as I can remember, riding my bike, going for runs, and it became so ingrained in me. A year ago, I started to notice back spasms and neck spasms, and I had a big trip to Europe planned to ride through the Alps, and I rode, and I got in great shape, and I just ignored all the spasms despite all the pain, and I guess thought it would just go away, but I was wrecking my back. The second week of season 8, I woke up in the middle of the night and my arm was numb. Hosting, I sat on the left side and all day long, every time I turned my head right, my arm would go numb. We switched my seat on stage, new chair, but the numbness went on. I would go lay down during briefings. Massage all day long with rollers. Sitting, no. I couldn't fly on a plane, and that's when I knew something wasn't right. Dr. Melamed was on the show, and I just said, look, I don't want to be an alarmist, but my arm has been numb. I said, Travis, don't be stupid. You need to get an MRI. No one likes to go to the doctor, including me, but just ignoring this isn't going to heal it. I was hoping it would show something that was just minimal.
It's all black in here.
There was impingement on my right C7 nerve root, and that's the nerve that, of course, right where I was feeling all the numbness.
We go here. See here how you see the left side here? The forearm going here? You're not. See, that's a disc here, and then there's a little fragments that's basically looks like it's pushed out. And that explains the tricep weakness. We can do a microsurgery, clean out that area, you know, in and out. Like it takes about an hour to do.
It's kind of sobering because I don't like the idea of surgery. I'm not 23 anymore. I'm 43. I have to change my ways. Are there
what I would do
conservative things that you can do?
You can do a lot of traction, some acupuncture you can try, you know, some soft tissue work. I've had patients like this who turn the corner.
Not necessarily what I wanted to hear today. Hopefully conservative treatments work. If not, I'll be going under the knife. I would like everyone to welcome Dr. Melamed to the show. And, you know, I visited you. That was back at the beginning of season 8, but your words, which were so profound to me, were, Travis, if you don't address this, your nerve could be shot for life. So I want to thank you for encouraging me to come see you.
Thank you, thanks.
But you sobered me up when you showed me the MRI, and you showed that there was definitely a reason for my numbness and my pain.
You had the classic symptoms, which is numbness, pain, stiffness, radiating pain, and the weakness. When you have nerve pressure, you could get any of these symptoms, but you had all of them. And the key was not ignoring them because you don't want permanent nerve damage.
The lesson I learned here is you never ignore numbness.
Absolutely.
Numbness and weakness, not a whole lot's going on right when that occurs. Is that fair to say?
Absolutely. I mean, you don't want to ignore that because if you ignore that, at some point that is going to become irreversible. You'll never get it back. So don't ignore your body. Listen to your body, get the appropriate treatment, and hit it hard. And the good news is 90% of the people get better without surgery, ultimately.
And I'm thankful to you. You're a surgeon. And obviously, you saw the look on my face when you talked about doing a surgery. And you said, look, I'm going to give you 3 weeks to start some rehab to see if we can start to improve these symptoms. And if you're going in the right direction,
that's right,
we can potentially avoid surgery, which is coming from a surgeon, which was really great because you got me motivated that day. And due to Dr. Melamed's advice, he recommended everything from acupuncture to seeing a chiropractor to rehab, physical therapy. So I took his advice, went running with it. That's coming up next. I found a team of holistic practitioners with the hope of avoiding surgery. Check out my journey. Physical therapy, acupuncture, seeing a chiropractor, and doing this in a very committed fashion. It was my only hope beyond surgery. I feel like this is a wake-up call to sort of redefine the rest of my 40s.
The body needs to have proper biomechanics in order to operate its optimal level. Now the nerve has been irritated. As we start to take the pressure off of that, we physically remove the pressure, open up that space. The nerve kind of has to do some healing.
Like, can't wait to get it up. Wake up, arm. This is where you have to have faith and put yourself in the hands of someone that you trust.
There's some gently without any discomfort. How's that feel, okay?
Yeah.
There's a lot of gas in the joint that's being released and it makes a lot of noise. The neck has a lot of range. There you go. That opens up that space.
5 days ago, I would get this far and it would just tighten up and then send the paresthesias. And honestly, it's significantly different.
When I start adjusting and moving things around, there will be a natural tendency for a little bit of inflammation to occur. And acupuncture is going to be very effective helping to calm that down.
Anywhere from 15 to 30 needles. Some will be distal on your feet, where we say the chi is the strongest. How was that?
I barely felt it.
Perfect. Dull, aching, pulling. These sensations are a good sign. This channel here comes up through your shoulder. And so I'm hoping this is going to take care of some of your paresthesia.
That was really nice.
The underlying focus of all of my programming is focusing on muscle imbalances, posture work, stability, mobility.
Just from bands.
Just from bands. That's all you need, I promise. Deep breath in, lay down.
This looks easy, but it's tiring.
These are very weak, so this is something that we're really gonna work on. We have a lot of work that we're gonna need to do in here. These rhomboids, a little weaker than I thought they were, but they've just been pulled on. You know, being seated, being biked.
Anytime you do one thing too much, your body's gonna break down. I'm convinced of that. And I may have been in great cardiovascular shape, but I was biking too much. And honestly, wearing spandex for 10 hours isn't that fun.
This is hard.
It seems like it should be so easy. Sweet.
Good. And I want to work on the way you get up a little bit, too. That's one thing.
Yeah, I've got a lot of work to do. I want to introduce my dream team of doctors who have helped me every step of this journey. Please welcome chiropractor Dr. George Mariella. He's the owner of Body Structure, chiropractor Dr. Chet Mallett, acupuncturist Aaron Nemi, restorative trainer and chiropractor Jonathan Leary, and Dr. Melamed is still with us. So, first of all, I want to brag about all of you because it was about 4 months ago that I went to get my MRI, and I could struggle through the days here. I could barely host the show. I wasn't having any fun. And for about 2 months, all I could do is I would go home and I would lay on the ground. That was it. And here I am 4 months later, and my body is starting to be restored, and I'm happy. I'm having more fun hosting this show than I ever have before. Thank all of you. So first thing you said when you saw me, and this is something that you always talk about, is the structure of the body. You know, you guys saw me, and you're like, wait a minute, your right shoulder's way, way low.
Yes.
And you had me look in the mirror, and I mean, my posture was terrible.
I think that's common. I think a lot of people will sometimes be diagnosed like you did with cervical dysfunction or cervical compression or disc problems. But if there's dysfunction, particularly like with your shoulder, you had upper cross-body syndrome, right? You had all these weakness happening with your chest, with your rhomboids. If you don't strengthen, stabilize those muscles, there's nothing to really stabilize and maintain the corrections that you're doing in the cervical spine.
And Dr. Mallett, one of the things when I first came to you, obviously I wanted it to be fixed immediately, but really starting to functionally move things around, which took time, but it was amazing as that process evolved for me.
Well, we could easily, identify, much like a dentist can identify sort of decay in your teeth, we can identify that decay in your spine or dysfunction that's happening. And basically being able to treat that right away, you get that window of opportunity before surgery at times to actually get in there and start correcting the function and allowing the decay to kind of slow down.
So after about 2.5 months of the therapy, then that weight came off the nerve, I started to feel a lot better. And through that whole process, Aaron, we talked about acupuncture, pressure points earlier in the show associated with migraines. What was interesting is it did more than just calm down physically. I have to say, I would feel calmer in every element of my life after I would leave the table. And everyone afraid of those needles, they don't hurt.
One of the greatest things about acupuncture is deconstructing that stress response in your body. So when you are that calm, that's where the healing and restoration comes from.
And by the way, I saw Aaron yesterday. I hadn't been sleeping well. I slept better last night.
Awesome.
Thank you. And a lot of you all saw me working with Jonathan. You're really focusing on this restorative element of really empowering and getting those muscles to fire that we stopped using.
Exactly. So the focus of the workouts is basically looking at these muscle imbalances caused by posture, and then we're looking at firing patterns, stability, mobility, and then we're just fixing it through corrective exercises.
And the funny thing about it, I have to finish with this story. For years and years, my mother, who is watching as we speak, used to make fun of me for my posture. And then as I biked more and more, it got worse and worse. And then obviously, Dr. Melamed, you diagnosed those disc herniations, and it was downward spiral. Mom, how am I doing? A little bit better?
She'd be impressed. She's impressed.
So if you're suffering from something like this, don't be like me where I kept canceling my appointments. Because if you do get on the road to recovery, you're going to end up, I feel this is going to be the best year of my life. Thank you guys for all your help.
Absolutely.
And we'll be right back.